I think we can get started. Good morning, everybody, and thanks for popping along on this gorgeous sunny Friday morning. My name is Sheila from BMR Health and Wellbeing, and I've pulled this webinar together. I run this webinar pretty much every Friday, and there's a few people who are on today that have been on before, and it's really on a subject I'm really passionate about, and a subject that Peter is very passionate about, which is workplace wellbeing, but really taking an occupational health and safety management approach, and being very structured in the way that we do it, which means we'll be compliant with the law, etc., etc. Just briefly about me, my background's in supply chain, quality management, lean and operations, and I'm kind of bringing some of those kind of practices into the workplace, because the plan, do, check, act cycle that we have within quality management works well for workplace mental health. So I'm going to do less talking. We do like this to be as interactive as possible. So if you've got questions, unmute yourself. Do feel free to interrupt. If it does get too much and it starts to slow us down in case we run over, then we'll just kind of call it, and then we'll pick anything up at the end of the session. But for now, I'm going to hand you over to Peter. Okay, thanks, Pete.
All right. I'm Peter Kelly. I'm a senior psychologist with HSE. That picture there is what my boss calls the lounge lizard look. So it was taken at Mad World by a professional photographer. I quite like it, actually. But I've been at HSE 23 years, and for 20 of those, I've been
Sorry, Pete, I've muted you by accident. One sec.
Let me start this all over again. I basically said I was a legend. I'm a senior psychologist from HSE. I'm also a bit of a lounge lizard, according to my boss. This picture here says from apparently whatever a lounge lizard is. I'm not quite sure it's a positive thing, but yeah. So I've been at HSE 23 years. 21 of those has been on. Is it now 21? Yeah, 22. Gosh, 22 of those years has been on mental health, work-related stress, and certainly 20 years ago, we were mortified that we had 9 million days lost to work-related stress, and yes, and yet last year, 1 week into the pandemic, we had 17.8 million days. So I think the landscape is changing, or has changed dramatically. Luckily, people are looking at mental health. Sorry, I can't see your join with. That's okay, Julie. So yeah, let's sort of get into today's discussion points. What we're going to look at is the statutory legal requirements for workplace mental health in the UK. So I'll take you briefly through those. What are the consequences for your business if you fail to meet those requirements? So that will take you through the legislation and how we interpret the legislation for the purpose of improvement notice or notices. The size of the problem, well, we've briefly gone into that, but I'll go into it a little bit more. Why I think you need to have an integrated workplace wellbeing program in place, and what does that mean for ISO 45003? And then we'll talk about psychological hazards and measuring return on investments, and me and Sheila will jump in between slides and take different opportunities. So next slide. So what is the current UK health and safety legal framework? Well, the Health and Safety at Work Act is law. Section 2.1 is to ensure that so far as reasonably practical, the health and safety and welfare of all your employees. Note, there is the word health and not just safety. We are not just a safety executive, we are the health and safety executive, and welfare and well-being is incorporated under the welfare of our employees. So we traditionally view work-related stress under the fact that under Section 2 you're required to do what is expected. Then under the management of health and safety at work regs, you are required under Reg 5 to carry out a risk assessment, and under Reg 5, you are required to put in reasonable measures to reduce the identified risk that you have. So both of those are laws. In terms of legal, if we were to take legal action, failure to risk assess would be a breach of Reg 3. Failure to do anything about a known breach because you've done a risk assessment would be Reg 5. And in all of the cases that we've taken, that's set under section 2.1. So 2.1 and normally management Reg 3 or 5, or management Reg 3 and 5 if there's no risk assessment. And then we've got best practice guides. So this is the HSE management standards approach, which we've been now dealing and doing this since 2004. It's an established process. It takes you through the risk assessment process you're required by law to do. And it looks at 6 areas, which are demands, control, support, role, relationship, and change. And these 6 areas are all part of work. And it's when they're not managed properly that we're into the realms of work-related stress. So best practice guides are there. We didn't make them law. I wanted them to be law, but we couldn't get an agreement between the business world and the trade union. So we went for management standards. Originally, the plan was ACOPS, which would have put in a degree of compliance. But we chose to do standards, and we've always kept on the basis that we have the possibility to use the regulations, and we'll use them in the right cases.
And I think as well, Peter, on here, you know, one point I just want to kind of raise here is nowhere on here does it say mental health first aiders, and all of the other stuff that we currently do around wellbeing is a legal requirement. And I, you know, from my perspective, I get particularly frustrated that organisations either are very unaware of this requirement in law, or they're aware and choose to do nothing about it, having a reactive rather than a preventative approach in a lot of instances when it comes to this. And in terms of doing the risk assessments and carrying out the risk assessments, especially in kind of today's world at today's time, it's now critical more than ever. And I think, Pete, you're going to come on, aren't you, and talk about, with the next slide, some of the consequences from a financial perspective. Organisations. Let me just drop it into the chat.
Sorry if I look very casual leaning back, but I'm trying to get out of the sun. So otherwise, if I stand in the sun, that's what you see, which isn't very good.
I mean, I'd be interested to know, I mean, we've got quite a number of people on the call, but how many organisations, and don't worry, Pete won't come chasing you down after the call. How many organisations, how many people are happy to say on here whether your organisation does or does not carry out workplace risk assessments for psychological health on a regular basis? And maybe I could just see something in the chat on that would be, you know, quite telling, I think, for everybody on the call as to kind of businesses that are and businesses that are not doing it. Because every time I ask this question, probably only 5 or 10% of people on the call are able to say they carry out risk assessments and it's part of a systemic business process. Anybody? Mute, unmute in the chat.
Hang on, I need to take a screenshot. I'm joking.
Anybody?
The reality for me as an inspector is people don't do it, and it's an easy breach for us, and yet you're legally required to do it. So don't worry if you haven't done it, because you're in a very large crowd, which is going to get very small as we start doing more regulation in this area, which we will do if the right cases are there. So
yeah. Okay, so I'm just going to move on to the case law. And again, Peter's wealth of knowledge is far greater than mine in this arena. But this is just to kind of give you some examples of the case law being applied.
this case law is case law defined in the court. So this is a rule of tort. So this is civil claims. And within these civil claims, there was a seminal case, which is Walker versus Northumberland County Council in 1995. And in that case, a precedent was set in law which said that employers have a duty to provide safe systems of works, and that should extend to the risk of psychiatric injury or illness. In the case of Walker, told his employer he was suffering from stress. They did nothing about it. He went off, he returned to work. Walker said, I've still got symptoms, but I'm coming back to work. And Walker's employer failed to put in any reasonable measures to manage a known risk because he'd been off. Walker was successful in a £220,000 claim. And that sort of kicked off a lot of discussions around the whole area. Barber versus Somerset was an interesting case in that there was a selection of cases that went before the High Court. And Barber, in the Barber versus Somerset ruling, it laid down 16 principles by Lord Justice Hale. Let me make this smaller. So, by Justice Hale, who we recently know about, was the High Court judge who was involved in a number of high-profile cases recently. And in that, Hale said in Hatton that it was for an employee who had suffered psychological injury to inform their employer. So the employer must first be in breach. The employee must provide proved psychiatric injury caused by breach, and it was reasonably unforeseeable on the part of the employer. Barber versus Somerset and what has become known as the Harton ruling was put in place to stop a tidal wave of cases as it was described. Actually, the principles in Hale that Hale put in Hatton didn't look at the consultation with experts in the area, because one of the 16 principles is it was the duty of the employee to tell the employer they were suffering from stress. If the employer or the line manager was a source of stress, this would be extremely difficult, amongst other things. But it came into being and is still there as case law. Next one.
Oh, sorry.
Right. So then we move into a different area of the law. So the previous law was establishing compensation under the basis of what was reasonably practical and reasonably foreseeable. In Majesties versus Guy St Thomas Hospital in the NHS, this set the precedence of a statutory duty that harassment and vicarious liability was important. In Majeski's case, the employer was found to be liable for the bullying that was suffered by the individual. Yeah, and that actually this took the Equality Act, which was subsumed into the harassment, which is subsumed into the Equality Act. It's bouncing around a bit. So Majeski versus Guy's St Thomas set the precedence using a different form of legislation, and that still stands today, that the employer is liable to protecting its employees from harassment and bullying. Green versus Deutsche Bank took this to a tribunal and argued under the Equality Act the same principle as Majeski, which was that harassment committed by an employee in the course of their employment is compensatable. In Green versus Deutsche Bank, the compensation was £800,000 because the employer was aware that Green was subject to harassment by a line manager. Next one, please.
Oh, sugar bags. Hang on. Is that? Can you see that something or not?
Just see the Google screen, so we can't see the screen. So you need to click on the PowerPoint one.
Sorry, guys, I'm having real technical problems with my laptop this morning. Is that back now?
Yeah. So we just go to the next slide.
Sorry, that's fine. Can you see now?
Okay. Yeah. That's
okay.
cool.
Apologies
So
for that. My computer's being a bit bonkers this morning.
that's all right. So the size of the problem. Well, there are a number of different reports that have come out recently. Deloitte's did October 2020 said that the cost to mental health was 42 to 45 billion. Okay. So that's made up of absence of cost of 6.8 billion, which is directly from our own stats, which is about 5.5 to 6 billion, presenteeism cost and turnover cost. Presenteeism cost is an estimate. And if you ask other people in this world, they would say the presenteeism may be substantially higher than the cost that you have there. But what we are seeing is a rise in presenteeism cost during the last few months, specifically because of the pandemic and what we're seeing in terms of work and how people feel engaged and supported at work. On average, the cost is £1,700 per year. If you take that across all of the UK workforce, as we've said, 17.9, and which is a massive increase. So it's up from 15.8 million, not 12.8 million. And yeah, so it's 15.8 million. The average return on wellbeing was 5 to 1. But actually, we've got other reports that show it's as high as 9 to 1. I think on our
Everybody, I think Pete's sound's just dipped out. If that's my side or not? Pete, your sound just dipped out.
I can hear you clearly, but I don't know.
Okay.
Let's see.
You're back on now. Sorry.
Okay, let me see if that helps. Right, there you go. So it's probably around 7 to 1. Now, there are very few return on investment in terms of numbers like that. So what we do know is if you do invest in wellbeing, it will benefit your organization. And what we found in the pandemic is there's been a significant return on investment in those that have looked after their people's well-being during this pandemic period. We've got some statistics here about there are over 3,064 deaths by suicide each day, 1 every 2 minutes. And in the UK, 18 people per day die by suicide. 75% of those are men and women. So, the numbers are fairly evident that we do have a large problem. Obviously, some of those suicides may not be in work or related to work, but it's still the fact that mental ill health is an issue.
And
Next
Pete,
slide,
where would you say where do you expect those figures to be? The 17.9 million, kind of gone up massively from the previous year and at a record high. What do you expect those to be? Are there an indication of numbers kind of this year?
But if you look at the data that's coming out globally, there's about a 20% increase in depression and anxiety. So we've seen this in people who've worked through the pandemic, and we're now starting to see significant sickness and absence in the healthcare sectors and the service sectors where people carried on working. But we may also see a reduction because people are not necessarily in work, and therefore, so it is hard to say. I'm prepared to err on the side. I think it's going to be the same or possibly go up. Just simply because if we don't see the effect this year, we will definitely see it the next year. There's a latency in some of this data as it comes through.
Yeah.
828,000 days, 828,000 people were off last year, 1 week into the pandemic. Now, there's been substantially more people have gone off over the 12 months of the pandemic for various different reasons. So it's whether or not they attribute that to work or to the pandemic. So it's a wait and see, I guess, in October. But I don't think we should then go, just because it's a pandemic, therefore we've got a decrease because it's a pandemic. I think we still have to constantly address these work-related issues.
Absolutely, because those figures are horrendous kind of pre-COVID, aren't they? So the pandemic isn't going to change that. It's just we actually have to do something about this, okay? coming on to this slide here in terms of how workplace mental health is often done, I'm sure that everybody on this call is familiar with that, and I'm sure that everybody on this call has some of that going on within their organisation. I mean, the few people that responded in the chat, there definitely wasn't much going on in terms of risk assessment. All of these things here are only part of a total solution. You know, mental health, first aid, employee assistance, all focused on injury management. There is nothing on that slide there that actually looks at prevention. And surely from a, you know, health perspective, whether it's physical health or whether it's mental health, surely prevention has to be the way forward. That's what we do when it comes to physical safety. So why are we not doing that when it comes to mental wellness in the workplace? So Pete, I want to let you talk on this next slide in terms of this integrated model of workplace mental health and this mental health continuum, and how this is kind of, we're needing to look at this total picture in terms of getting a total solution to the situation that's going on, and not as my friend Vince would say, their approach of, oh, look at these people that are stressed and not feeling very well. Okay, so Pete, do you want to pick up on this one? Has he gone? Yeah, okay, well, I'll carry on then until Peter pops back in. So yeah, when we're looking at this integrated model of workplace mental health, what we've got in the workplace is essentially a mental health spectrum, okay? So we've all seen the continuum in previous mental health sessions, and essentially everybody in your workplace will be on this continuum in some way, shape or form. Okay, so we've got people in the business that are going to be flying, they're going to be zooming forward on, you know, in a really good positive area of optimal mental wellness. The majority of people in the organisation will exist in this place of mental wellness where we're getting up, we're coming to work, we're motivated, we're getting on with our job, we're doing some basic self-care, we're looking after ourselves well. And then we've got this group here that are in this languishing piece. Now, if you look at the piece underneath here, you know, when we're looking at promoting flourishing and looking at mental wellness, we're picking up all of these people with the health promotion and all of this type of thing. When we're looking at people that are languishing, these people are either going to go one way or the other. They're going to get themselves back to mental wellness, or they may go down into having a mental disorder or mental ill health. Okay, and as organisations, in terms of our current approaches to workplace mental health, this languishing piece is getting missed, yeah? Because we're waiting for people to be one or the other, and they're just sitting in there with little or no support. So if we're doing the preventing harm, if we're doing the risk assessments, if we're looking at the risk management, then and the stress management and educating people, then there's more chance that we can shorten this languishing element and therefore reduce the risk of mental ill health in the workplace. Okay, so you know, when you look at the national standard of Canada on psychological health and safety, and then we look at what the ISO standard that we'll come on to in a little bit says, you know, a workplace that is doing two things, it's promoting psychological well-being, yeah, but it's also actively working to prevent harm. And most approaches at the moment are all focused on triaging stressed employees, okay? And that is not the way to go. Surely, yeah, an alternative approach would be to address the design of work and not the people. And what I mean by that is that, you know, we would not tell somebody who pops along to Tesco's distribution centre as a picker-packer, we wouldn't take a look at him and go, or her, you don't look very strong. Can you lift, you know, 30, 50, 60 kilos? We wouldn't give them a gym membership and tell them to go to the gym and press weights to be able to lift heavier boxes. We have guidance in place. We have safe systems of work so that we can look to prevent injury. So why do we feel it's acceptable to ask people to be more resilient to levels of stress. You know, if you're looking at it that way, surely that's very similar to telling somebody to just go to the gym and be stronger. Okay, so what we need to be doing is really looking at the way work is organised and looking at the design of work. And this is where we're starting to see a shift with, I wouldn't say the introduction of psychological health and safety, but I would say more emphasis and more focus on psychological health and safety, which is hopefully, and Peter will talk about this in a lot more depth because he's had the last few years of his life very focused in this area, is the development of this new standard, ISO45003. And Peter's had, I wouldn't like to hazard a guess of how many hours of your life have been spent on this, Pete, in the last few years. But Pete's been involved in the development of this standard with how many different countries across the globe?
74.
74 different countries across the globe. And what I want to do now is really just to hand over to Pete and for Pete to talk about why this is hopefully the game changer that we need in our approaches to workplace mental health, because the standard really puts emphasis on looking at the organisation, the work design, and taking a risk-based approach. Okay, so what is the scope of ISO 45003, Pete? Over to you. He's gone again. Oh, he's back. You're on mute, Pete.
I may have to jump in on my phone if it does it again. So
okay.
Can you hear me at the moment?
Yeah.
Let's bomb through this then. Okay, I can't see the slides, so which is, I think it's down to, I've got a bandwidth issue.
Okay.
What's the slide up? Can you?
The slide.
There we go. Good.
What is the
right? Okay.
What is the scope of the standard?
So 45003 is an attempt to internationally coordinate what we expect people to do on psychological health, safety and well-being. And it is being developed with the ISO conglomerate, which is the International Standards Organization, and BSI. I will not have any, my bandwidth's low on this apparently, so I won't have any of the slides. So Sheila will just have to prompt me when the next slide's up. But let me just take you through the conversation about it anyway. So 45,000 really set out core principles of what you...
Pete, you've gone again. Do you want to look to rejoin from your phone? Yeah, okay. So I'll just carry on until Pete comes back on the phone. So with the scope of ISO, sorry guys, 1 second. I think you're on your own. Oh, he's back. Hang on a sec.
Right, let's do this. I'm going to switch myself on off this one. Can you put me in the waiting room for this one?
Which one, Pete?
The fireplace one.
Yeah, I can.
Actually, I'll leave. That'll be easier. Done. Oh, there I am. Two of me.
Okay.
Right, we're back in. This is all going to be done on the phone. Okay. So if we look at 45,003 in the context of a changing world of work, what we've got is loads of people looking to promote mental health, promote well-being, but actually we're not doing it in a systemic kind of way. 45,003 attempts to put that system in place. It attempts to say, here's a safety management system that we have in law, and what we're requiring people to do is have a similar level of standard, but it's not law. So it's what we call it, not a defined standard, it's a voluntary standard. So that's what 45,000 attempts to do. Now, across the globe, there are fundamental differences about
what we mean by psychological health and safety and well-being. And what we've tried to do through 45003 is have those conversations. Is that okay? Can you hear me?
Yeah. And Pete, what about it? You know, well-being generally falls under the scope of HR, and the standard's been specifically put under occupational health and safety, hasn't it? Can you talk about the reasons for that?
Yeah, I think it's because, well, we believe it's both HR and occupational health and safety, and I think this demarcation of responsibility is part of the problem. Is if you see it's exclusively of HR, OH doesn't do it, and if you see it's OH, HR doesn't do it. And I think this is a systemic issue across businesses, and actually, it's like any other risk that you have there. You wouldn't differentiate and go to health and safety or top. If it's a risk that affects the functioning of that organization, then it needs to be an organizational stress, an organizational risk. So it's shared by everyone. It needs to have KPIs involved, that you put the organization to accountability to manage mental health in the workplace.
Yeah. Okay.
So it does my head in when people go, is it HR, is it occupation? It's all of you. It's whatever.
Exactly. And businesses don't work in silo in many other systematic or systemic business processes. So there's always a collaborative approach, isn't there?
In this area, they do, because they blame each other and don't actually get
Absolutely. And that's the point, isn't it? It's this working in silo, it's somebody else's problem. And as when it comes to workplace well-being and occupational health and all of those things, there has to be, again, this fully integrated approach that we're getting buy-in across everybody, because everybody's got value to add and relevant contribution, skills to contribute.
And if people, because they want to overcome this in the process, they'll separate it, they'll give it to different people, but that's where accidents occur, and that's where ill health outcomes occur, because you don't know who's responsible. You're all responsible. The employer, the employee, the manager, the HR, all of are responsible for the psychological health of and safety of your people and their well-being. And well-being, as you said before, can't simply be about EAPs, mental health first aiders, fruits and pears and massages and everything else. It's a systemic thing about what do you do to make the workplace a place that makes people healthy, that actually lets them go home. In making people healthy, you make the workplace safer.
Yes, absolutely. Healthy people, happy people, safer workplaces, absolutely.
People are more engaged and then are more likely to say, I'm not prepared to do this, or I don't think this is the right way of doing this, because actually they're not under pressure. They are under pressure, but not the pressure that doesn't allow them to say, maybe we should be doing this a different way, you know.
Absolutely, and therefore that's where you get this, where we talk about this increase.
Sorry about my low bandwidth issue and it bouncing around.
It's much better now you're on the phone, actually, Pete.
Okay, good.
Okay.
Hope you didn't, I hope you didn't hear me swear when I went.
No,
when I went up.
It was all good. It was all good. Okay. So when the next slide is really just talking about these key elements of the ISO standards. So I think if we're kind of talking through this, it's looking at it, as we've already said, within the occupational health and safety system, using the risk-based approach. And if we don't understand the organisation from top to bottom, that's going to be really difficult to do as well, isn't it? Okay.
Yeah, well, I mean, if you look at the principles which are in the 10 principles, 4 for me is fundamental: leadership and worker participation. Right, leaders have to be engaged on mental health. A leadership that puts health and well-being or mental health meetings at the end of the day or the beginning of the morning at lunch is not an engaged organisation. They're not prioritising it. They're not putting it as part of the business. If you want to send the message that we are taking this seriously, then do it as part of the day. Then make it your KPIs. Then make it in people's performances that actually, is about managing people's health. Yeah. Define the responsibilities at all levels. Who's responsible? We just had a conversation. Is it HR? Is it OH? No, everybody.
People. Yeah, so, absolutely. Yeah. And Geraldine in the chat's just made the point here, and this is, you're absolutely right, Geraldine. employees absolutely have a role to play here. Employees have responsibility for their own psychological health and safety in the workplace. The owners cannot be always just on the employer. It has to be that shared responsibility in the workplace, for absolutely sure. Really good point.
Yeah, yeah. And the other point there, which is in the chat about actually employees should be able to make better choices about their health. Absolutely, but you need to give them the facility to do that. And actually, so if you're going to do health and wellbeing programs and you're going to have gym memberships, make sure the gym memberships aren't off-duty gym memberships. I've seen people being offered wellbeing programs, and they said you can go to the gym when it's at between 7 in the morning and 9, or at 8, 7 o'clock in the evening till 10 o'clock. It's the message that it sends out. You have a gym membership, do it properly, which give people the flexibility to go to the gym for an hour and in the day, at lunch time. If they want to do that, let them do it. And it's just thinking about how you're creative with the jobs and the roles that you do.
Yeah, because it's all right, as you say, Pete, providing the tools, but if you don't allow them to use them at a time that's reasonably
but one that actually helps their health rather than puts them under strain, really.
And I say this a lot on this call, is that people know when people are paying lip service to something, and if they know that it's only lip service, you just throw your money away, and you might as well not spend it. If you're going to do it, you need to do it well, and you need to do it in a way that it's measurable across the whole organisation.
I don't even think it's a nice to. I think it's a have to. It's a must to. You know what I mean? You can't just go. Literally, you can't. You cannot think of your health and well-being of your workers as an afterthought. It's functionally at the centre of a successful organisation. The companies that are successful in this country and globally are successful look after their people's health and well-being. They look after their physical and their mental health, and they're involved in supporting them outside of work in the context of supportive practices for working from home, etc., or job crafting their job so it fits their strengths, and they do it. And the reason they're successful is because they do that. And the product becomes we draw success on the amount of products we sell or the objective we sell. We don't look at our workers and think, what can we do so our workers can drive that productivity? And that for me is where it's at. People who are suffering from distress at work due to overwork, excessive pressure, which is uncontrolled, are not going to be your best employee. And we've all had experience with that, where we thought, I feel unmotivated to work. So
absolutely. And again, the standard talks about making sure there's resources and training for everybody in there as well, doesn't it? So not just training 5 mental health first aiders in an organisation of 100 or 1,000 people, which we see.
And it defines what those elements are. So it's got examples in there of practices that would fit under each of those criteria. So it gives people some guidance there. Effectively, it's a health management system. It's a psychological health management system. If you're familiar with a safety management system, which is 45,001, what 45,003 is that system for psychological health, but as a voluntary standard. Personally, I would have. I can see a time in the future when we, and a not too distant future, when we may have to, they may have to revisit this and go, well, actually, should 45,003 become a defined standard? There's a lot more negotiations that have to go into it. But if you're only going to do it because you're expected to do it and you do it on the standards, then there's got to be a conversation had about that, hasn't it?
Yeah, and I think as well, large organisations and to kind of get some buy-in behind this. My background is in supply chain, and big organisations that are going out to tender, and I think we've got big construction companies. Within your tenders, you can specify that you would like organisations to be at least compliant with certain standards. You would necessarily make sure that they've got certain safety things on site. So, and everything that you'd put in your tender documents around safety would be related to physical safety. Why not psychological safety as well? And if we can get big organisations driving that in things like tender documents, if we can get insurance companies getting on board and offering premium discounts for businesses that are adopting psychological health and safety practices, this will then start to push this tide of change across business, because it will happen. You know, it's the beginning of that journey. We've kind of gone into it with mental health first aid and other stuff that, does form part of a wellbeing strategy, but it's not a psychological health and safety solution. Okay.
Yeah, and let's remember that 57% of all days lost to occupational health and safety, we're nearly 2/3 of all days lost is down to stress, depression, and anxiety.
Yeah.
And if you take the safety element out of days lost, health itself accounts for 4/5.
Wow.
So the big issue here is the health of our employees.
We need to get health management, don't we, to the same level that we have safety management.
Yeah, health and safety. Just what people do is they do safety management, and then they go, "Oh, okay, what about the health?"
Yeah, absolutely. So kind of coming on to that in terms of the health management and looking at, how we identify those risks. It's a basic risk assessment process, isn't it, Pete, in terms of identify the psychological hazards and the primary risk factors. We look at them and assess them as we would a safety factor. So what are the changes that can be made? How do we then look to put some mitigation and some controls in place to, actually to mitigate those risks? And then how do we assess the effectiveness? A basic risk management approach, but applied to psychological hazards. It doesn't be difficult. We don't have to reinvent the wheel. We don't take what already exists.
What you do need to include, though, which is the additional step, which is that you consult your employees.
Absolutely, and all of it should be consultation. Absolutely,
because I know this circle comes from the Canadian standard. So in discussions with the Canadians, because obviously we have an additional step, because it's enshrined in our health and safety law that you need to consult with your employees on health and safety issues. So yes, there is included in that is that in order to mitigate control, you've got to bring your workers along that process. So once you've assessed, and then you say, well, what can we do to make it different? And that's really important, because actually employees have a far wider, more in-depth knowledge of what the issues are, and they have they'll get used to the solutions way quicker than you, as a manager thinking, or as a board of directors thinking that you know what the solution is. Ask your employees what the solution is to the problem.
Yeah, and give them and empower them to actually make the changes, and then
and say, if you're going to do this, then these are the things that we would expect to do. We will do this because this is what you have told us. There's a report out in 2006 from the European Union called The Spice of Life, in which it said it is way greater to do this and offer something and do nothing about it than to do nothing at all. Which was basically saying that we need to be engaged with our employers, and that remains so very true today as it was back then. I don't know if you're aware, but under all the COVID-19 risk assessments, we expect you to say what you're doing to support the mental health of your employees, in terms of managing their stress.
Yeah, and Kalsoom's asking, a little bit more about methods of mitigating risk to psychological health and safety. And I think, it is this risk assessment process, in answer to your question, Kalsoom. But there are various different ways and means and tools that you can get. And I think,
the good examples of preventative approaches is where you take if I had a graph, but then I'll try and describe it to you. If you think of think of stress and mental health as a continuum, what we're trying to do is to get people to do prevention rather than cure. Yeah. When people are ill, so if they were to the right of the graph, that's illness. Okay. To the left of that is healthiness, and in between is where most of us are. Yeah. So we go back to integrated mental health. What we're trying to do is to move the languishing into sort of mental wellness, and that takes time. So the prevention bit is reduction of the mental disorder, but then putting in place systems and processes that encourage people at work to work to the best of their ability. So if you've got a job, and let's say there's a job that produces 100 widgets, but the people on the line can only pick up 70 widgets in the maximum time frame you want them to do. There's something about the job that's inherently needs changing, and that's what we're talking about. The prevention side is look beyond the individual and think, well, the individual needs to change. Oh, well, the individual's changed, but we've still got a problem. Look at what is it about the way work is designed and done that needs to be changed to maximise the potential for your employees.
Yeah, and this is where
you do a risk assessment. That's how you do a risk assessment to find out where your issues are, and then you go back, into that process.
Yeah, and it's really getting to that root cause, isn't it? As you were just alluding to there.
Yeah. The root cause isn't the person; it's often the system.
It's the system. The system of
work. If you accept that the system may in itself not be 100% good, then you're on a start for 10. But most people blame the individual and go, well, it's because they're not resilient, they're not mindful, they're not this, they're not that. And I was on a call recently and I said, there's so many buts and nots here. But no one's actually looking at it and go, well, do you think maybe the way we've designed the work in itself is wrong?
Yeah.
We buy systems for IT off the shelf and then say we want you to use that. We don't buy the systems on the basis of how will our employees work with them. We expect the employees to adapt to them. And I see this in factories, we've got this amazing system. Yes, but did you consult your employees in designing the system? Well, no, because we made a decision to buy it. And it's like, well, you didn't bring your people along. Therefore, they could have said, no, this system won't work because of this. And that's all the time that happens, is that there's this lack of engagement with employees to say, what can we do here and how can we do it better and in a different kind of way?
Yeah. Okay. Fantastic. Okay, so when we're looking at psychological hazards, you touched on these already earlier, didn't you, Pete?
I did, yeah.
These are the areas that we should be looking at. So, these are the risk factors in the workplace that will either contribute to you having an environment where everybody's flourishing and everybody's happy, therefore everybody's productive, engaged, and working well together, or they are major stress factors. You've got to have that balance, you've got to get it right somewhere in the middle for that to work well. So, workload can go too much, it can go both ways. If we have too much, then we're stressed. If we have too little, we can be stressed or we can be insecure about job security, that type of thing. And again, autonomy, are we micromanaged? Are we not given any direction? We're not given any support or clarity in terms of what we're doing. So it's really, really key that we ask people how they are thinking, feeling about all of these different factors in the organisation. And the way that we can do that is in terms of surveying and asking people. That's the only way you're going to be able to get the information, is to consult with the employees. As Pete said, consultation is absolutely key when it comes to doing this. So we need to identify the risks. Okay, we have a psychological health and wellbeing management system that we use that will allow us to conduct surveys around the work environment. Okay, and around that we're asking a battery of 82 questions over, it takes 15 minutes on an anonymized basis to say to people, do you feel supported by your manager? Do you feel supported by your co-workers? If we can understand this information, just on by asking the questions and getting the feedback anonymously, then we know where our problem areas within our workforce. So we ask the question, we get the answers, or not the answers, we get the responses, okay? And then when we've got the responses, we can look at an aggregate score of where those problems actually exist. What are the areas that we need to focus on? Workplace wellness, workplace mental health, psychological health and safety, it's an ongoing process. You don't do a physical health and safety assessment once and then leave it and never do it again. So this is a continuous systemic part of your business process. So we're assessing the risk, we're looking at it, where are the areas that we need to focus on? Is it work-life balance? Is it workload? Is it autonomy? Is it growth and development? You know, is it management support? What are the problem areas? And then when we've identified those areas for improvement, yeah, we consult with the employees that contributed to that feedback, and in consultation with them, we pull together a mental well-being management plan. Therefore, i.e., we've been to Department X, we've identified workload as a high risk factor from the surveys, and now we've got together, we've spoken to everybody, we've pulled that together, we know what the cause of the problem is because we've had open discussions around it. All of this is done without any blame game, any finger pointing. It's done across consultation with HR, health and safety, quality management, people who are doing the jobs, and then those solutions to those concerns are brought up collectively, okay? So that we can then put some smart objectives in place. It's specific, it's measurable, it's achievable, it's realistic, it's timed, we can crack on with it, okay? So that covers off kind of the mitigation part of the risk assessment circle in terms of controlling the risk. And then we need to know that what we've done has had the desired effect, and we need to look at the data set from the first time that we did it, i.e., what the points were at which we identified the issue. We've then taken some actions. We need to resurvey that same data set again, okay? And we can do that, and we can look at were the areas that we wanted to see a change improved with the actions that we've taken. If they were, fantastic. Are there any other areas that have come up that we need to focus on next? It's an ongoing cycle of continuous improvement. And because I come from a manufacturing background, and I don't know if anybody does on this call, for me, it's all very much about taking what we call a Kaizen approach. And this is done a lot in manufacturing. And this is just simply a strategy where all employees at all levels of the company work together proactively to achieve regular incremental improvements, combining the collective talents within the organisation to create a powerful improvement. Oh, somebody's unmuted there. Oh, mute, I think. Yeah, so it creates a really powerful engine for change. So you're developing this organisational culture where everybody's actively engaged and employed, and that's what you need when it comes to workplace mental health. Okay, so if we look at the Kaizen approach and a Kaizen cycle and apply it to workplace mental health, it's not rocket science, okay? We get employees involved. We would do that if we had a problem in sales or production or manufacturers. We get employees involved that are doing the jobs, right? We gather a list of what those problems are, and then we talk about potential solutions and ideas, okay? So we're already here with meeting the standards of ISO. Let's consult with everybody. Let's gather a list of problems, a risk assessment. Let's do the assess and control part here in terms of encouraging solutions and an idea. Then we're going to test it. Did it work? Then we regularly measure and check it. Did it work? Absolutely brilliant. Let's adopt that. If it didn't, let's go again. Okay. Taking this approach will then spiral off all of the other well-being or improvement activities that you need to do in the workplace. More often than not, it's not yoga, it's not gym classes, it's not massages, it's improving the way that work is carried out. If we can improve the way that work is carried out that's causing the stress in the first place, we remove the stressor. Really, really simple approach. We overcomplicate it with solutions that actually just don't hit the mark. They're nice to haves as part of an overall package, but we're missing this fundamental piece in the middle. Talk to the people doing the job, talk to your employees, and get it sorted based on what they're telling you, okay? And then you need to put in some KPIs. If you can't measure it, or you're not measuring it, what is the point of doing it, okay? So again, by using the survey tools, by asking people the questions, you can get the feedback and get the answers. So we can look at two different sets of KPIs, okay? We can look at cultural KPIs, okay? And employment KPIs, okay? So we've got our financial ones and we've got our cultural ones. So, you know, what type of culture do we have? Is it so toxic that there's a large intention of people to quit in the organisation? How do we know that? We asked them anonymously, intention to quit. Would you be out of here today if you could get another job? Absolutely, or definitely not. Wouldn't that be great if we knew how our people in our organisation felt? If we could look at, do you feel that you're at risk of burning out, that you can't cope anymore? Yes or no? We could look at burnout risk scores, a really important factor in telling you whether or not you've got the right culture within your environment. And again, with stigma, you know, people that have got EAP programs or MHFAs, why don't we ask people in the organisation, would you access them? And if not, why not? A great teller of what the cultural barriers are in terms of people accessing support within your organisation. So those are all kind of really key KPIs, okay? The ones that we always think we can't measure, but we can. And again, going back to, you know, when Pete was talking earlier about the cost of mental health, what it costs us, the £42 billion a year. These are figures that we can measure in our own business. We can look at how many days did we have lost to sickness, yeah, versus how many days were available. What's the total days lost and our average cost per employee? You know, how long is an employee spending with the company? And if they're leaving, are they going out in droves because they're hopping off because of the culture and they don't like the way the organisation's run? Or is it that the way that we're recruiting isn't right, we're not getting the right people into the business, so it's very much employer-led, okay? So well-being is measurable, okay, in a very significant way. You know, in a lot of organisations, staff costs make up around 70% of your total costs. Why do we not break it down? Why do we not get further into it? So, you know, we really need to have those KPIs in our business. I mean, Pete, would you want to add anything else in there?
No, I just think make the KPIs relevant. That's the important thing.
Yeah.
And relevant and achievable, isn't it? I mean, you've got to apply the same principles as SMART objectives.
Absolutely.
To your KPIs. Sometimes we create KPIs that we know are unachievable, but they look good.
Yeah,
and you lose face then. You know what I mean?
Yeah,
so
and it doesn't have.
Go on.
I was just going to say, and it needs to just be a small number as well. Yeah.
Yeah.
4 or 5 KPIs, 4 or 5 indicators, so it's not too onerous to do.
Yeah, and you don't want them all to be, you know, lagging indicators. You know, you want some leading ones there as well. Absolutely.
Okay, so what I want to do is kind of draw it to a close there for questions for Pete or myself. So feel free to unmute and ask away.